The great concern, of course, is that in doing so and infecting ducks and chickens, but now increasingly mammals, that virus now evolves and develops the ability to infect humans, and then critically the ability to go from human to human transmission. And we know that in the rare cases, I think off the top of my head, 400 or 500 cases so far of humans, the mortality rate is extraordinarily high. So to me, this is a major concern. And obviously, Maria Van Kerkhove is the lead on this within WHO and has enormous experience in all of this. And I know even this week there was a convening on vaccine development for H5N1, for therapeutics for influenza, which we are not where we need to be, and ensuring that regional offices and country offices and public health authorities around the world have got the capability to diagnose H5N1. The current outbreak, for want of a better word, in America amongst cows is really concerning as well, and also talks to this issue of transmission. We have to understand in those cow settings, sheds, how H5N1 is transmitting, because it may be evolving into transmitting in different ways. Do the milking structures of cows create aerosols? Is it the environment which they're living in? Is it the transport system that is spreading this around the country? So this is a huge concern, and I think we have to watch, more than watch, we have to make sure that if H5N1 did come across to humans with human-human transmission, that we were in a position to immediately respond with access equitably to vaccines, therapeutics, and diagnostics.
Hi, everyone. Welcome to the Moms on a Mission podcast. It's so great to connect with each and every one of you. Thank you for being here today. If you're new to the Moms on a Mission podcast, our 3 pillars are to educate, awake, and activate others to help protect our children and save our nation. And that's why I wanted to have our guest back on today. We welcome back to the Moms on a Mission podcast, Dr. Peter McCullough. As you know, he's a world-renowned cardiologist and epidemiologist, and he's a very successful author. He has over 1,000 publications. He's also the chief scientific officer at the Wellness Company. I wanted to have him back on to address this crazy hysteria and this quote unquote pandemic with the bird flu. You know, this is really picking up steam. The media has been pushing and fueling this fear, and they're just acting like it's going to hop from animals to humans so easily and quickly. And I researched this, and I noticed how it takes hundreds to thousands of years for a virus to naturally evolve from an animal to humans. And so I wanted to ask him how supposedly this dairy farmer in Texas could be diagnosed with this right after the cattle were diagnosed just weeks before. And then did he really have it? Because they're using this same faulty PCR tests. You know, they produce so many false positives with COVID, and now they're using those same tests with this. So how could this even be confirmed really when the tests produce so many false positives? So I asked him that. But most importantly, we talk about what we can do to be prepared. You know, there's no need to be scared. We have God on our side, and spiritually we can be prepared, but there are things we can do in the natural physically to be prepared as well. And we talk about that. And one way we can also be prepared is no matter what happens to these cattle, we can have some freeze-dried meat in our cabinet. You know, I know freeze-dried sounds maybe a little weird. I thought so too, until I actually tried it. And it's 95% fat-free, so it's incredibly healthy, and it tastes good. My 17-year-old son eats it as well. So I use it for chili and tacos, but I also am stockpiling because we don't know what's going to happen. And so if you just go to griddownchowdown.com, type in the code MISSION, you'll save 5%. That's griddownchowdown.com, code MISSION. Also, the link is in the notes below the show. And just grab a few and just start stockpiling some. And, you know, it lasts 15 years. So what's the worst thing that can happen? You can, you know, use it in 5 years if everything is just fine and we don't have any shortage on food. So just grab the link below the show or go to griddownchowdown.com, code MISSION. They also have a subscription plan. You can do that too, so you don't have to think about it, and you can just get a little bit consistently. That's griddownchowdown.com, code MISSION. And as you're preparing for the future and supporting your family, you're also supporting the Moms on a Mission podcast. And for that, we are so grateful. And please share this episode with your friends and family and on social media. I think it's so important that we nip this in the bud and we share the truth. And then we'd be so honored if you followed us on social media, on Instagram and X. Instagram, we're Moms on a Mission 918. And on X, we are Moms on a Mission OK. Thank you so much. And without further ado, please welcome to the show, Dr. Peter McCullough. Dr. Peter McCullough. Welcome back to the Moms on a Mission podcast. It's great to see you again.
Oh, it's great to be back on Moms with a Mission. And boy, your mission is so big and so important right here, right now.
It sure is. Well, I wanted to talk to you about this new pandemic hysteria that seems to be all the rage right now. You know, this propaganda has shifted into high gear, and the globalists are seeking, it seems, more control and attempting to derail another election. I mean, how interesting that this thing called bird flu is coming out right now. And you're just hearing lots of news stations talk about this. And I wanted to share with you a couple of things that I saw. NBC shared back in April, they said that bird flu confirmed in Texas worker who had contact with dairy cows. And I found this highlighted portion to be interesting. It said the person's infection comes just days after it was reported that dairy cattle in 5 states, including Texas, tested positive for the virus. So again, that was April 1st. And then this next article here from NBC, and it was on the news as well. It says, and this is, of course, this is the next one dated May 3rd. And this says dairy worker with bird flu never developed respiratory symptoms, only pink eye. And, you know, they say that this gentleman never had any of the symptoms typically associated with influenza, including fever, coughing, or sneezing. And of course, the only indication was, you know, the pink eye. And so I guess I was just thinking about COVID and all the strategies that they use to indoctrinate us and do the fear mongering. And the last thing I just wanted to point out here was this article from PubMed, which is interesting because that's, you know, a government organization. And they said that if you look at this highlighted portion, it says many people all over the world are in close proximity to animals due to local customs or due to their way of life. One can suppose that single transmission events of animal viruses to humans, viral exposure in human bodies, cells by direct contact, are happening daily on the order of millions of times. The vast majority of those events are not successful in causing infection. This is the thing I really wanted to talk to you about, Dr. McCullough. It says it takes hundreds or thousands of years for a virus to, quote unquote, gain the right combination of mutations in order to insert in human cells and survive further through spreading in multiple individuals. So, you know, we're hearing about the cattle. They're just finding out that the cattle has bird flu. And now just days, weeks later, not very long later, it's all of a sudden they've said that a man in Texas has it. And I just find that very interesting. When you read their own words, they say that it takes hundreds and thousands of years.
Why were they testing cattle just a few days before he got it? Normally, a human would get an illness, then you test the animals. This is all very suspicious. And, you know, our scholarship on Courageous Discourse Substack now has broken this wide open. This is what we know. Bird flu has been around for decades. There have been about 800 cases and a pretty high fatality rate, about half, but most of the time underdeveloped countries, presenting late. It looks like secondary pneumonia is the most common cause. People just not treated. And honestly, I think with modern day treatment, there shouldn't be any deaths due to bird flu. But most of the time it's with animal handlers, people handling the animals. So things started to get worse when the Chinese started vaccinating the birds. Now the birds can carry it around more. They don't get sick. Normally you just observe it. A few birds would die and they'd get natural immunity. Another thing that's made it worse is culling, that when birds get bird flu, they actually destroy all the birds in a poultry flock, for instance. So the birds aren't getting natural immunity. So vaccination and culling has made it worse. Then the French started vaccinating in the summer of 2023, just basically ducks that were, you know, ready for, preparation of edible duck meat, and immediately America banned it. So America does not vaccinate poultry. And then the United States, we had a case in 2022 in Colorado, and some poor man who worked at a poultry farm, he was ordered to destroy all the chickens because there was a case of bird flu. He actually got bird flu by handling all these chickens. I don't know if they were trying to incinerate them or what. So it backfired, and now we have this case in Colorado. Now in the last several months, we've had CDC emergency warnings, USDA emergency communications, WHO briefings, former White House pandemic coordinator Rick Bright making statements, Jeremy Farrar, chief scientist at the WHO. This is really ramped up. The man with conjunctivitis or pink eye made the lead article in the New England Journal of Medicine. We've learned that there's mass testing, PCR testing now of animals, poultry, and cattle going on. That's going to generate more cases. Again, more orders for culling. Sid Miller, the ag director, ordered for mass culling and destruction of millions of egg-laying hens in Texas at Calgain, the nation's largest egg producer. And then it keeps going and going. We're on the verge, I think, of the U.S. vaccinating the poultry, which is going to be a disaster. It's going to make things worse. We have a company, CSL, that already has a human bird flu vaccine, government-funded, pre-purchased, ready to go. They have and it's an antigen-based vaccine, but they have a messenger RNA self-replicating vaccine, in the wings. The CEPI, the Coalition for Epidemic Preparedness and Innovation, with the Koreans also have a self-replicating messenger RNA vaccine in the wings. And now, to make matters worse, there's a specific strain or a clade that's spreading from mallard ducks to cattle and other poultry, because the ducks fly over the place, and it recently spread to a dolphin. But this strain is a gain-of-function man-made strain. It looks like it's coming out of the USDA Poultry Research Center in Athens, Georgia. So this is our independent research. Then after that, former CDC Director Redfield comes on major news and says, oh yeah, it said in order for this to jump to humans and spread, it has to be gain-of-function research. And he said, there's no way in nature a 5 amino acid change in a hemagglutinates is going to happen. He says, but we could do that in the lab in a matter of weeks. So Wow. This is all coming to, I predict that there will be a bird flu outbreak. It'll primarily be in animals. It'll cause constraints on the food supply. There'll be a big push for human vaccination. There may be a few human cases among animal handlers, but we can handle that with our approaches: dilute povidone iodine nasal sprays and gargles. Then, of course, oral antivirals. At the Wellness Company, we recently expanded our Contagion Kit to cover bird flu.
Oh, that's great. I'm going to ask you about that, but I wanted to ask you this, Dr. McCullough. So how could they know exactly these viruses mutate, and how would they know exactly what this virus mutation was going to look like in humans to already have vaccinations, quote unquote, vaccinations ready to go in the wings?
It's all based on genetic code. They know the code, and so they prepare the vaccine based on the code.
That is so incredibly disturbing to me when I think about that these vaccinations are made before we even see this mutation presented in humans.
That's right. Now, the bird flu vaccine from 2021, the CSL vaccine, I'm sure it's just for H5N1, the animal strain, but this new clade that's jumping into humans, it wouldn't take but a few changes on the computer screen, and a messenger RNA vaccine could be cranked out. That's the stated goal of messenger RNA vaccination, is to be rapidly responsive to whatever strains are out there. But you can see with COVID, the messenger RNA vaccines didn't work, and even when they had new boosters, they always came out too late after the strain was already gone.
Well, and then we also see the damaging effects. I mean, you've obviously appeared before Senate and, talked about that. I mean, they're not even, well, I think now they're acknowledging to a degree some of the harmful effects that these injections have caused. But I think that this is kind of presumptuous of them to think that we're not going to use critical thinking skills and see what happened the first time that they shoved this propaganda and this fear mongering in our face, and wouldn't give us access to these early treatments just so that they could accomplish their agenda of injecting the nation. And we saw that it didn't help. In fact, it did more damage than good. That's what you have shared. I've heard you talk about that. If we would have just used early intervention, all these people who were either handicapped, maimed, or died, this wouldn't have happened.
We should have had risk stratification, identifying high-risk patients, an early treatment protocol, should have been updated probably monthly. McCullough protocol was the most widely used and adaptable protocol out there. And then we never should have vaccinated with the genetic code for the lethal spike protein. Remember, Pfizer, Moderna, AstraZeneca, Janssen, and Sputnik, that's actually genetic code that we cannot shut off. And so it was a disaster to do this. And we're finding people now 3 years after the vaccine developing cardiac arrest, blood clots, all kinds of problems. They haven't taken a shot since 2021. And here we are in 2024, and they're in deep trouble. My office is filled every day with patients like that.
Yeah. And then you also can't help but think about these calibrated PCR tests that had all these false positives. And so now they're still using these PCR tests to test for bird flu. And you're thinking, okay, you had all these false positives with COVID, and now you're using this same faulty system to detect bird flu. How do we believe these people?
It's true. And, animals are pretty hard to tell if they're sick or not. You can't check for fever, listen to their lungs very well. So they're going to rely on these PCR tests, and they'll be testing in animals that are flogging around and in dirty environments. There's going to be a ton of false positive with this mass testing of livestock. There's going to be a ton of culling or intentional destruction of animals. And the farmers don't care because they're going to get paid anyway by the government. So we're looking at food shortage. I don't predict a human disaster. I really don't. But I think there's going to be a disaster for farming and livestock. And that's going to be perfectly timed right ahead of the WHO deliberations on their National Health Pandemic Treaty and International Health Regulations. This is the WHO is going to say, listen, we have to have this to step in and handle bird flu. And then when we come down to the U.S. elections, I have a hard time reading that, to tell you the truth. Both Trump and Biden are aligned on the vaccines. They're the same. So I don't, honestly, I don't think the U.S. election is the same when it comes to the vaccines and the unsafe COVID vaccines, which is the biggest issue out there. So it's not too satisfying there.
Yeah. And it's 173 days away. And I just find that this is so fascinating that this is being injected into our nation 173 days before this election that will be pretty big in other areas. I understand what you're saying regarding this, but I also find it interesting that I've been researching this. I just kind of went down a rabbit hole today, and I was seeing that a lot of the farmers are not letting these folks come in and test the cattle, and they were suggesting that it's because they might have a lot of illegal immigrants working on these farms. But I find it fascinating that they're not able to come in and implement their agenda, which is, testing and using these faulty PCR miscalibrated tests. And so I think that's kind of interesting, and that'll be fascinating to watch that, to see if they're able to test very much, because I think that's part of advancing this agenda is, testing and getting all these false positives.
Yeah, I agree. Now, the PCR test for bird flu, you can't commercially buy them. So Fisher is a distributor, they distribute it, and the U.S. government controls PCR testing for bird flu. So it's not like they're commercially out there. We'll have to see if the suppliers and shippers and others begin to require it. If they mandate testing, we'll have to see that. But you're right. What farmer would want to do that unless they had some type of ability to do culling, and that's like mass incineration? That's going to take work and effort in order to get that government subsidy. So I think you're right. We'll have to see. Certainly at the cattle level, poultry, we already had an ag director give the order, and they have to do it in West Texas. So, I studied this in Texas. There wasn't mass culling. They used to have small flocks. We had some in Dallas in the last few years with bird flu. They're just observed. The birds are observed until they recover, and that's it. It's not a big deal. We're making a big deal out of a bird virus, and gain of function research is trying to make it jump. If humans get infected one by one, I can tell you right now, we need to be nailing this down, that this is a man-made virus from the very beginning. Just like with COVID-19, it was covered up. SARS-CoV-2 was a man-made chimeric. And Anthony Fauci, Peter Daszak, Ralph Barrick, and Dr. Xingling Li are the co-conspirators. They just recently nailed Daszak and said he can't get any more government funds. They kind of shut down his government gravy chain. But the other ones are still off scot-free right now.
Yeah, that's so incredibly wrong. And I'm hoping that justice will be served. I think one of the ways that we can successfully push back, at least I saw it with monkeypox and Marburg, is that, I think a lot of us just took to social media and started speaking the truth and explaining, hey, this is an agenda. This is not what we don't need to be afraid of this. Do not fall for this. Again, this propaganda and this fear mongering. And I believe with the bird flu propaganda that's one of the ways. But another way is to get on the wellness company website and you get some of these early interventions. And you were just, screaming that from the rooftops in the very beginning with COVID. And I feel like now people are learning and realizing and understanding the agenda with they were trying to hold back on that early intervention so that folks would have to take these injections, these toxic injections. And so I was just thinking now, we know this, a lot of us know this now. So what should the folks get? I have with me the medical emergency kit, and I talk about this quite a bit because of this guidebook that's in it. I used to sell pharmaceuticals, and doctors, as you know, and you do, that there are FDA approved usages and off-label usages. And that's what I love about this particular kit and the other kits is that it comes with a guidebook, and that's something you just can't get anywhere. And folks really can early intervene in these virus situations. And so I was going to ask you, you did mention the Contagion Kit, which I have here as well. And you said it was updated to treat bird flu. So do you recommend that folks get the Contagion Kit in this situation, or do you think the medical emergency kit works as well?
Well, the medical, but probably should have both. The medical emergency kit is kind of the broad-based kit. It handles, bladder infections, bronchitis, fungal infections, cellulitis. The Contagion Kit is really what you want the farm handlers to have, the people working right now. I think they all should have them if they. And what it has in it is not only coverage for COVID or SARS-CoV-2, but coverage for bird flu. So at the first instance, would want to start the drug oseltamivir, also known as Tamiflu. They got the Contagion Kit's connected to telemedicine, so the doctors can quickly upgrade the medicines if needed. And in addition, if there's any wheezing, we can use that budesonide actionator. So that's a really good move. Secondary antibiotics, should be at the ready. But I think by and large, if we just use the iodine-based nasal sprays and gargles, and it's interesting in the paper that it was used in COVID-19, the Chowdhury clinical trial of dilute povidone iodine, they actually used eye drops too. Iodine is safe in the eye. And that man who got the pink eye, probably just using a very dilute iodine, eye drop would have killed the virus.
Wow, that's great. Well, I love that. And I did that iodine after I listened to you. I did that rinse and it helped tremendously when I had COVID. I wish I would have started it earlier, but man, these things, work but they don't, produce a monetary gain for the pharmaceutical companies and these globalists. And so I guess that's why they don't want us to know this information or obviously have access to the early intervention. So if folks go to twc.health/mission, they can save 10%. And I love that you're the chief scientific officer there. I think that, the fact that you're supporting this early intervention and you've done it all along and you've seen such positive results, not just in your practice, but nationally and globally with your McCullough protocol and these tactics and ideas on ways to treat early. I just think that this is wonderful because you have data to support what you're saying.
There's another product that came to mind that I think probably everybody should have if we do have this threat. And the product is called Natural Immunity. And it's basically the elements that would be in some form of a broad multivitamin that specifically have evidence to boost the immune system. And everything in there actually has supportive data. My mom has been susceptible to infections in senior living. I have my mom on it, and she's really doing well. I think there are some products like that people ought to look at. If they've had COVID or long COVID or the vaccine, they should really look at what's called the Ultimate Base Spike Detox. It's based on McCullough protocol, base spike protein detoxification, spike support. Principal product in there is nattokinase, and then bromelain and curcumin. So they're bundled in a trio. If people go on, they use your promo code, get a membership. The kits come deeply discounted. We're working on ways of, by the way, replenishing the medicines once they're used in the kit. That's going to come with membership. And then, of course, your discounts on the supplements are all U.S. sourced, very high grade, and we stand behind them.
I'm glad you mentioned that because I had somebody say this, and because I sold pharmaceuticals, I know the answer to this, but I really wanted to know what your thoughts were. And so I did hear someone say, well, the bottle has a one course of treatment for a particular disease or illness that you contract. And I know when I sold pharmaceuticals that the doctors would actually use these, not prescribe expired medications, but folks would get expired medications and take them on missions trips because I heard physicians say that they can still be effective past their expiration date, like 4 or 5 years or something like that.
Yeah, well, as a general rule, 2 years for sure. Okay. Some last out to 10 years, but they have a much greater shelf life. That's the reason why they're in the amber bottles, so there's no sunlight exposure. Keep them dry. Many of them have like a little desiccator, like something that actually keeps it dry inside the bottle. And so if you just take care of it well, these last a very long time.
That's great. And I didn't realize that you were working on that if you're if you have a subscription that you can get refills and just fill that kit right back up.
Well, we had a meeting. I asked, are we ready to announce it? They said no, but when it does happen, the refills are going to be for members. So I just think it's critical. Just get a membership. It's easier. You log in, the membership discounts there, and you can always use these additional promo codes. So they allow multiple promo codes. So they allow people who are listening to actually really get the cost down. It's very cost favorable compared to just buying it on Amazon. You can buy Wellness Company on Amazon too. It's just less expensive in the website, twc.health.
That's great. Well, twc.health/mission saves you 10%. Dr. Peter McCullough, thank you so much for your time. Thank you for what you're doing. I really can't thank you enough for going out there. I mean, you have sacrificed a lot, and I know that you're doing well, but you really are speaking the truth in the face of adversity, which is really quite disturbing and sad. But I just want to say thank you for your courage and your bravery. How can folks connect with you and follow you and learn from you?
Central place is my website, petermcculloughmd.com. That'll take you everywhere. My podcast, McCullough Report, America Out Loud, Talk Radio. My podcast, Courageous Discourse Button. And 90% of the content is free. Sign up for it. It's the most widely read Substack out there that's providing graphical abstracts, late-breaking interviews. Daily content comes out. Courageous Discourse Substack. My book, Courage to Face COVID-19.com, 1,200 5-star ratings on Amazon, most widely read. And actually, I think probably the leader of the books in the COVID genre, because it's written by best-selling author John Leake. It reads well. It's entertaining. You learn a lot. We have to stay on top of that. Like you, I'm broadcasting on a lot of channels. I give a lot of public presentations because this has been a time of great controversy, great suffering. Sadly, we've all had losses in our family due to COVID-19 illness, and sadly now due to the vaccine. It's really a time to pull together and help support each other through these difficult times.
That's right. Well, thank you so much for all you do. And I want to encourage people to follow you on X. You just passed 1 million followers, and I think that is just so great. You really are able to get your message out to now, over 1 million people. And so I just encourage people to follow you there too.
Thank you.
Well, thank you for your time. And thank you all so much for listening. As always, you can email us at moms@momsonamission.net. That's moms@momsonamission.net. And don't forget to get a kit today at twc.health/mission. You'll save 10% off with the code MISSION. And thank you all so much for listening, and have a great day.